I'm Dr. Audrey Yu-Speight. I am a veterinary ophthalmologist or an animal doctor who treats eye problems. I treat all kinds of animals. I treat small animals like guinea pigs and mice. I see a lot of dogs and cats, parrots, sometimes rabbits, and I also treat large animals. In particular, I treat horses, pigs, cattle, and sometimes we go to the zoo and treat the lizards or the other animals that are having problems there. When you come to our eye hospital, this is the first room that you visit. We have a waiting room and a lobby just like any other clinic, and this is where animals come. After you check in with your animal, then you go into the exam room. Here's a photo of our exam room. In our exam room, we use specialized equipment in order to look into the eye and see what's wrong. People always ask me, how do the animals sit still for their eye exam? We basically pet them and talk to them, and they sit on the table on this nice pad. Sometimes they sit on a towel or a blanket, and I basically use equipment to look into their eye and see what's going on. The first instrument that we use is to look at the front part of the eye, and this lets us see the cornea, which is the clear window in front, and the iris, which is the colored part of the eye. We can also see the lens, which is what focuses the light onto the back of the eye. This instrument is called a slit lamp, and it basically makes a little line that allows me to look and tell how deep the eye problem is in the eye. After that exam, then I look into the very back of the eye using this headset. This headset basically takes my two eyes and focuses them together through the animal's pupil so that I can see everything in the back of the eye in 3 dimensions. That way I can tell if something looks raised or if it looks sunken in or if it looks just flat. And so from there I can tell why an animal may have gone blind or what exactly could be happening in the very back of the eye. This is the same equipment that physicians or human doctors use to look at humans as well. Let's take a look at some of the problems that we may see. So this dog's eye turned completely white. We couldn't even see the brown color of the eye. This is a very, very unusual problem actually, and it needed to be treated with medication. This is a medical problem. Basically, this dog ate some really, really rich fatty food, a steak, and all that fat that was into the blood leaked into the eye and turned the eye so white we couldn't even see the colored part of the eye. So in that top picture, that's how the dog looked when he came in. Unfortunately, he couldn't see. His eyes were blind from all this fat and white material in the eye. After 1 day of medical treatment and eye drops, as you can see in the lower picture, the eye started to clear up and the dog got his vision back. So sometimes the eye problem just needs medication. Other problems can be much more complex though. So besides medication, we also do surgery on the eye. Just like with the exam equipment, I do need to use very strong magnifiers in order to make that small structure look much bigger. I sometimes put stitches in the eye, or I move tissue around and do tissue grafts, basically to help the eye heal itself. Let's take a look at a couple of things that help let us know whether an eye is normal or not. So in this black dog, you can see that glow back from the eyes. It's called a tapedo reflection. And animals have a layer in their eyes that kind of shine the light back more than people do. That's why when a deer gets caught in the headlights of a car, their eyes glow back. So in this black dog, you can see that both eyes are glowing in a very similar way. Sometimes one eye will glow in a different color than the other, but the shininess of the glow will tell you whether there's a problem. In this yellow dog, this golden retriever, you can see that there's an issue. One eye has that nice normal shine, and the other eye, you can't see the shine at all. And that's usually a sign of an eye problem. Another example is an animal that's squinting an eye or holding it closed all the time. And that usually means there's some eye pain, that there could be something else going on. Now, we all squint a little bit if we get dust in our eye, but if we have a real injury, then that squinting or holding the eye closed may be going on for even a day or longer. And that usually means it's time to pay a visit to your regular vet. A general veterinarian will look at the eye and they treat all kinds of eye problems too. But if the eye problem is particularly difficult or rare or really problematic to figure out, then they will send the animal on to the veterinary ophthalmologist or the eye specialist who treats animals. Here's a fun fact. We used to think that animals saw in black and white, and we found out that that is completely not true. Birds even have better vision than humans and see even more colors than we do. So this picture of a garden in the upper picture, that's what a human would see looking at the garden. In the lower picture, that's what a dog sees. So dogs absolutely do not see in black and white. They do see in color. Now they're kind of a red-green colorblind. So they see blues, they see yellows. That's why they love those yellow tennis balls, but they don't see the reds and the greens like we do. So when you go to the pet store and you're picking out toys for your dog, make sure to look for those yellow and blue toys. If you're out in the street and you see a dog wearing a plastic cone on his head, that is called an e-collar. And that is basically like a cast on your leg to kind of help protect that area and keep them from hurting themselves. The e-collar is a very important part of some eye problems so the eye has a chance to heal. It's called an e-collar because it's named after Queen Elizabeth, who was the Queen of England in the 1600s. And she basically wore these giant ruffles on her neck as fashion. And now we call these e-collars Elizabethan collars after Queen Elizabeth. Thanks for visiting with me. I've had fun telling you about being a veterinary ophthalmologist. Bye.